Good afternoon. My name is Marcus Gust, and I'm here today to talk to you about a devastating affliction that is harming children and adolescents at an alarming rate across this country. What would you think if I told you that today there is a largely fatal disease affecting our young children and adolescents? The disease affects children of all backgrounds, regardless of ethnicity, socioeconomic status, or geography. This disease makes a person 70% more likely to die an early death related to heart disease, stroke, or lung cancer. And what if I told you that this disease is easy to diagnose, largely curable? This disease can be treated therapeutically and only requires prescription drugs in extreme cases. Yet with all these factors present, this disease is rarely discussed and often misdiagnosed or simply ignored. Now what if I told you that this disease is called childhood PTSD? Childhood PTSD is a symptom of what is usually a series of traumatic events or circumstances known medically as adverse childhood experiences. Today we will clearly define childhood PTSD and why it's still largely undiagnosed. We will go on to discuss how big the problem is and finally how we can treat it. Childhood PTSD and adverse childhood experiences were found to be linked in a landmark study that was done by the CDC in partnership with research department at Kaiser Permanente. The study concluded that children who suffered adverse childhood experiences were 70% more likely to die from diseases related to PTSD. Adverse childhood experiences are generally traumatizing events that happen between the ages of 0 to 17, and they include the following: experiencing or witnessing violence, experiencing or witnessing sexual abuse, family member attempting or committing suicide, being surrounded by substance abuse at home or in the community, mental health issues at home, parental neglect, or separation due to incarceration. The problems facing educators is that telltale symptoms of childhood PTSD are very similar to those of major depressive disorder and general anxiety disorder. Anxiety and depression are much more prevalent buzzwords in today's society, and too often children are labeled depressed or anxious when in reality they are dealing with life-threatening situation at home or in the community that we, as primary care providers, are failing to identify. Some simple diagnostic criteria that is unique to childhood PTSD are as follows: trauma themes expressed in repetitive play, recurrent and intrusive traumatic recollections, recurrent distressing dreams of the event in young children, frightening dreams with unrecognizable content, acting or feeling as if it were happening around them or to them again, more akin to hallucinations and flashbacks rather than normal memories, intense psychological distress at exposure to reminders of the trauma, and intense physiological distress at exposure to reminders of the same trauma. So how big is this problem? ACEs are very common. The CDC Kaiser study found that 61% of adults surveyed had suffered an ACE, while 1 in 6 of these respondents reported to have more than 4 ACEs during their childhood. There are 98 million people living in poverty in North America. Children living in poverty are 5 times more likely to have ACEs than the rest of the population. This is not an insignificant number. Yet the CDC study originally surveyed a population that was 70% above the poverty line, meaning that the outcomes were multivariate and occurred across various income strata. The maltreatment of our young children is not merely ethically untenable, it is economically disastrous. In the US alone, the total healthcare burden associated with childhood neglect and abuse is valued at $124 billion in the year of 2008. These problems rival the cost of type 2 diabetes and strokes combined. Adverse childhood experiences can also have a tremendous impact on broader lifelong health and well-being outcomes if left untreated. For example, exposure to violence in childhood increases the risk of injury, future violence, victimization, and perpetration, substance abuse, sexually transmitted infections, delayed brain development, reproductive health problems, involvement in sex trafficking, non-communicable diseases, lower educational attainment, and limited employment opportunities. Chronic abuse may result in toxic stress and make victims more vulnerable to a problem such as conduct disorder, delayed learning, attention, and memory difficulties. So how can we treat it? The CDC has recommended many strategies that can aid treatment. The strategies and approaches laid out are intended to work in conjunction in a multi-sector, multi-level effort to prevent violence and neglect. Every child is better off when he or she feels safe and lives in a stable, nurturing environment. The CDC study recommends a 5-pillar approach to combat instances of adverse childhood events. Strengthen economic support to families by increasing financial aid to lower income families and incorporating family-friendly work policies with their employers. Adjust social norms to support parents and positive parenting via public engagement, campaigns, and legislative efforts to reduce corporal punishment. Access to quality education and care in early life. This involves preschool enrichment with family engagement. These improvements can be fostered through an improved licensing and accreditation process. Improve parenting skills to enhance healthy childhood development. This would involve early childhood home visitation and programs aimed at improving parenting skills and family relationships. Intervention to lessen harm and future risk prevention. This approach includes enhanced primary care behavioral parent training, child care behavioral parent training programs, treatment to lessen harms of abuse and neglect exposures, treatment to prevent problem behavior and later involvement in violence. In summary, it is our duty as frontline caregivers to provide the most stable and safe environment for our youth. And this includes identifying health risks outside of the classroom. It's important to get to know the children we're responsible for so we can tailor their health needs to their specific cases. We must sweep away the debris left behind by generations of lazy diagnoses and look out for the obvious markers of PTSD and adverse childhood experience. I have identified the main causes of these problems, and together, armed through better strategies, we can change the health outcome associated with trauma and our kids associated with trauma. Our kids will always face danger and diversity outside of our supervision, but it is our responsibility to channel the best healthcare options we have at our disposal towards them and their families. Thank you very much.